Good evening. My name is Isabel Germano, and this is Future Leaders in Neurosurgical Oncology by the AANS CNS section on tumors. And tonight we're here to share some very interesting platform with mentees that have been nominated by our previous panelists, and these are all executive committee members. Dr. Susan Panula and Brian Nahed are the chairs of this event, so I'm going to hand it to you, Susan and Brian.
Hi, thank you guys so much for joining us tonight. And I guess we'll just kick it off and get started, yeah?
Sounds like a plan.
All right, thanks, Brian. So our first speaker is Leo Ampey, who was nominated by Desmond Brown from the Tumor Sections Research Committee. Do we have Desmond on? Okay, so you know what? Let's get going. We'll let Leo give his talk.
Do I share my screen? Oh, there we go.
Oops, sorry.
And I can tell you that Leo is a PGY6 at UVA and NIH. Go for it, Leo.
Yeah, thanks again for the invitation. I'm Leo Ampey, 6-year resident, part of the UVA NIH program. And I'll be going to Miami after residency to do a fellowship with Drs. Komatar, Ivan, and Dr. Shah. So my passion for neurosurgical oncology stems from the basic science aspect of it. There are a lot of labs focusing on curing glioblastoma, but I think the ability of glioblastoma to impact the immune system and or the body in general is not well studied. So when I came to the NIH, I joined a neuroimmunology lab that had no experience in brain tumors. So I brought the GBM component to that lab, and I wanted to focus on the effect that GBM has on the dura mater. So why the dura? In the last decade, it was discovered that the dura has lymphatic vasculatures and a very robust immune landscape. So I was curious to see the impact of GBM on the dura. So at the very top left is a whole mount or a picture of a dura. In green is tumor GBM, and at the very top is a transverse sinus. And we've noted that in red as well are veins. So we noted that whenever GBM is abutting the meningeal space, the transverse sinus forms these sprouts of veins that plug directly into the tumor proper. And via 2-photon microscopy, we noted that the tumor itself is secreting byproduct protein and antigen through these veins to the transverse sinus. And where this is going, well, the main filtering organ of the body is the spleen. So at the very bottom, in red, B cells, in green, plasma cells, in white, immunoglobulin G plasma cells. So we hypothesized that antigen is being drained superiorly from the dura mater through the sinuses into the periphery. So there is a very robust perivascular humoral response caused by GBM. And unfortunately, despite this robust immune response, it cannot eradicate glioblastoma. So the next question is, where is this failing that we're trying to answer? And very lastly, a lot of basic science studies work in mice, but do not translate to human biology. So we were very fortunate to acquire the entire dura mater of a patient that succumbed from glioblastoma with a GBM abutting the meningeal space. And I'm not showing this here, but through microscopy, we actually corroborated our basic science results. So there's a very robust vasculature response in the meningeal space and immune response as well. Next slide, please. So aspirations for neuro-oncology. My main aspiration is to own a lab and be a surgeon scientist. And this stems from my childhood watching my mom fight and survive stage 4 ovarian cancer. And this basically invigorated me to finish school. So I was the first person in my family to graduate from high school, college, medical school. At the very top left is me graduating from medical school and hopefully residency in the next year. And yeah, cancer is still afflicting my family. At the very bottom to my left is my aunt who recently passed away from stage 4 cancer. So I believe that by owning a lab and basically providing to the basic science community and the field, we'll be able to find a cure. And mentorship. So my first mentor in neurosurgery, neuroimmunology, and neuro-oncology is Andy Parsa. I did a Howard Hughes Fellowship, 2 years with him back at Northwestern before he passed away. And he has been a very instrumental figure, not only in my career, but my life. And I hope to mirror his career in the future. And my last aspiration is to invigorate the interest of students from disadvantaged backgrounds in medicine and neurosurgery. So I was born in the South Bronx, not so great community. The attrition rate for my high school was over 40%. And I believe me going back and others going back to these communities and teaching students about our field, about medicine in general, it can inspire others to pursue our field. And when I'm not in the OR, not in lab, I'm home hanging out with my puppy, Charlie. That's all. Thank you.
Thank you, Leo. That was spectacular.
Thank you.
Wow. Thank you, Leo. Our next panelist is Georgina Rincon-Torella, who was nominated by Chitan Betagauda, also from the research committee. And I don't see Chitan yet, right?
Hi, Dr. Panuller. We actually were closing in the operating room, so he sent me here, but he said if we could wait for a few minutes for him to join.
We can't. You have to go now, and then we can ask him to make some comments at the end.
Oh,
Go ahead,
no problem.
Georgina.
Go for
Perfect,
it. So I
no
can
problem.
introduce you, Georgina. So I know you're a neurosurgery chief resident and soon a assistant professor. So go for it.
Thank you so much, Dr. Panulo and Dr. Germano. So yes, I'm a PGY6 at Johns Hopkins and starting as an assistant professor with the tumor and skull-based faculty. I graduated from the University of Barcelona originally as an IMG. I did different sub-internships at the Brigham, at Ohio State University, and at Hopkins. And I had the incredible opportunity before residency to join Dr. Alfredo Quiñones Hinojosa, and I did a 3 years and a half of postdoctoral fellowship in neuro-oncology with him. He had been one of my great mentors before and during residency. After 3 years and a half where I did clinical research on awake craniotomy for gliomas, and we also worked together on writing a video atlas of neurosurgery, I had the immense honor of joining the residency at the Department of Neurosurgery here at Johns Hopkins. My main focus during my 2 research years has been brain tumors and the development of new drugs. I had the incredible opportunity to work with Dr. Ver Vogelstein at the Lubin Cancer Center and Dr. Betagauda on liquid biopsies, but mainly on designing a new drug compound that targets a metabolic transporter, MCT1, which we first tested in pancreatic cancer, which is the main focus on the lab. And I want to translate it into glioblastoma that has hyperexpression also of that metabolic target as my first project as a junior faculty. So as I mentioned here, my passion for neurosurgical oncology stems from the combination in between technical skills and also compassionate care for our brain tumor and skull-based surgeons, and also the endless opportunity to apply research to advance the field. There's so much that we don't know yet, and I would love to be able to participate in helping our patients a little bit more through research and education. And second slide, please. My aspirations are in 4 different ambients. One, achieve clinical and surgical mastery. First and foremost, I want to be a very good neurosurgeon and combine my work in the operating room with my work in the lab, having a symbiotic relationship in between those big aspects of my career. But for me, it's very important the mentorship that I've received, especially from Dr. Betagauda, Dr. Gallia during my residency. I want to give back to the medical students and especially IMGs, how other people did for me. And that goes to the last point, international knowledge exchange. I would love to be able to build bridges in between the United States and especially Europe and Spain. And I'm doing that a little bit by doing a joint PhD program with some of the research that I did during my 2 years of protected time under an R25 towards a doctorate degree. And on the right side, while I'm not doing neurosurgery, I really enjoy my family. At the top left upper corner, you see my sister that recently moved with me to Baltimore. At the bottom on the left, you see my family. Most of them are still in Spain and in my little town called Blanes. And on the right, my fiance's family from Colombia. We love traveling. On the right upper corner, you see two of my co-residents, Anne and Jenny. We were a 4 female year, the year that I matched, and they have been an impressive support throughout my residency. And in the middle, we have Tiro and I have a rabbit pet, Mocha. So I wanted to introduce her to all of you. Thank you so much for this incredible opportunity to be able to share a little bit my story. And I appreciate the time you are dedicating to us.
That was great, Jordina. Thank you.
That was beautiful. All right, next up is Brian Choi, and he was nominated by our very own Brian Nahed, chair of this Committee on Development and Partnerships.
Thanks,
Brian?
Susan. Thanks, guys. Thanks for everyone. And thanks for Isabel for bringing us all together. I have the great pleasure of introducing Brian Choi, who I've known not only throughout his residency, but after he joined our faculty at Mass General as one of our tumor surgeons and one of my favorite colleagues. At MGH, he's the associate director of the brain tumor immunology and immune therapy and leads what you'll hear today is the exciting lab effort on developing CAR T-cell therapies for brain tumors. It's a novel treatment that he first developed during his residency and is now being tested. And we're super, super excited that the clinical trial will be starting soon. Before this, he completed his MD and PhD at Duke with John Sampson and Dara Bugner. He's been a tireless advocate and passionate faculty member working with residents and is a great colleague and friend. With that, I'll turn it over to Brian.
Thanks, Dr. Nahed. Yeah, first, I'd obviously like to thank Dr. Germano, the whole section on tumors, Dr. Panullo for putting this event together, and also Dr. Brian Nahed. Thank you for that kind nomination and incredibly generous introduction as well. It's it's a real honor to be here featured in this session, get a chance to share a little bit about myself, and also to see a couple of familiar faces on the call as well. As Dr. Nahed mentioned, I recently joined as a new faculty member here at Mass General Hospital in the Department of Neurosurgery, and previously finished my residency here back in 2021. And I think part of what has made this time really special after training is that I've had the opportunity to continuously grow and develop with the support and mentorship of like all my colleagues and the attendings that I served as a resident with here at Mass General within tumor surgery. And it's I think it's been a really unique and rewarding experience for me now as a young attending to take an active role in the education of our residents in our program, not only inside the OR, but also outside of this. And on the top, you see a photo of me and a couple of the other residents after I joined the faculty, where we were going through some anatomy in the cadaver lab. This is really something that I enjoy doing and a passion of mine. And I guess one thing to add about staying at the same institution where you train, it's really afforded me an incredible perspective of seeing many of my friends who are interns and junior residents now develop and become senior and even chief residents who are leading the clinical service. And I just have to say that's been incredibly satisfying to me. In the lab, as Dr. Nahed mentioned, I also lead a separate group who seeks, to really develop the next generation of immune therapies for patients with brain cancer. Specifically, I'm active in designing cell therapies, or CAR T cells, as you mentioned before, that many of you may be familiar with, both in the sense of engineering these cells to be more potent and effective against brain tumors, but also understanding aspects of the immune microenvironment that are particularly challenging for tumors in the brain. So on the left, you see a picture of a CAR T cell that we designed in the lab. And it's a colorized photo, but that's a glioblastoma cell and culture under it. And this is really a lot of work that has been done in collaboration with Dr. Marcella Moss at our cancer center, who's in that middle photo with me. One of the exciting announcements is that a CAR T cell that I had the chance to develop and patent actually during residency has now progressed in development and is now being made available to patients with glioblastoma here at Mass General. This will really be the first clinical trial for CAR T cells that target any type of brain tumor at our institution, and perhaps really only one of a handful that's been tested in the country. And so it's all been the result of a huge team effort over the past few years, but we're very excited about it. We are in our final countdown at this point, and our first patient is scheduled to be infused just at the beginning of next month. So this idea of bridging a gap between what we discover in the lab from bench to bedside is a theme that I'm really enthusiastic about, and I hope to continue carrying forward that in my early career. Yeah, so it looks like a photo is not being shown here, but I would like to just point to my mentors who have made the transition from residency to faculty possible. There's a photo. Here in that photo, I'm taking over the grill after making about 10 pounds of barbecue. And I think that's one of my hobbies. And I think I'm in deep discussion on what I'm sure is some kind of controversy in immunotherapy with Dr. Curry and his family, who's been a great mentor of mine. I would say that finally, outside of the OR, I like to take every opportunity I can to spend with my wife, Carmel, who's pictured below. She's also faculty at Mass General and a psychologist here. So we get to kind of go through junior faculty life together. But anyway, thanks for the time. Thanks for having me on this panel. Appreciate it.
Great. Thank you so much. Our next speaker is Olu Akindura, who was nominated by Alfredo Quinones, who serves on the Development and Partnerships Committee of the executive team. I don't know, is he on?
No, we spoke not too long ago. Unfortunately, he had a major conflict he couldn't get out of.
Got it. All right. Well, I can do this slide for you. So Olu is the chief resident at Mayo Clinic in Jacksonville. And Olu, go for it.
Perfect. Thank you. First of all, thank you guys for the opportunity. Put way too many words on here. It shows Dr. Q, and he was the one who suggested to add all of this. So unfortunately, he's not here to take the blame for that. But anyway, I mean, honestly, for me, I'm a little different from probably most of the other panelists here because I actually started, my interest started in skull base and, microsurgery, anatomy and all that. And I, at some point, shifted to the dark side and I became a lot more interested in spine. And, but I love oncology. So, thankfully, I've had the opportunity to kind of merge the two. I spent a year in the lab, thanks to an NREF grant, and was able to focus on research with chordoma as well as spinal mets. So the thing is, I don't really see much being done on the spine side in terms of basic science research. I mean, you still have a patient population that needs targeted therapy. There are no targeted therapies, and there is, isn't much that I'm aware of being done. So I was hoping to kind of help bridge the gap. And there have been a few patients that have kind of brought it full circle for me. One is a patient pictured here in the right lower corner. She essentially came in, she had C3 met, severe weakness. We took her to the OR, did a corpectomy. She did really well, got, her strength back. And, but the issue is, she was treated with systemic therapy, and her systemic disease, responded well. And even though we got a gross total resection, she had, progression of her disease, in the spine. And there have been a lot of studies that have shown that once a tumor metastasizes either to the brain or to the spine, there are some different genetic aberrations that may not be exactly the same as the tumor of origin. So one of my goals is to kind of focus on that and see if we could provide better care to these patients. And that upper right picture is a cover figure, actually on this month of April, JNS Spine that was featured. So basically that just summarizes some of the work we've done with a pathway known as YAP, or yes-associated protein, targeting YAP using a drug called verteporfin and encapsulating them in these microparticles. And I basically found that they would sensitize these tumors to radiation and shrink them. So basically they decreases growth and makes them more responsive to radiation. So I'm hoping to expand on some of that work. I'll be spending a year with Zia Gokazin at Brown soon, and then coming back here as faculty and planning to start a lab. So everything's kind of coming together. So you can probably go to the next slide. Yeah. So my goal, like I said, my goal is to build a spine tumor program here at Mayo, Florida, and really, like I said, the basic and translational aspect of spine oncology. I mean, there are some people, but I really don't see much in terms of actual NIH funding for spine, specifically spine oncology. So my goal is to kind of fill the gap and help advance that aspect. And then teaching has been a huge thing for me that I've grown to love. There's a lab that I was able to start here, like monthly spine labs, and Dr. Almeida, JP Almeida, has been focused on the cranial aspect of it. So we've kind of been tag teaming, and we made a curriculum, and just mentoring as a whole is something I've always been passionate about. So I'm excited about continuing some of that here. And for me, I don't know if you've seen my background, but my one of the little ones here has been bothering me and tapping on the window, trying to join the Zoom call. But of course, family is everything for me. That's my son, who's almost 2. He'll be 2 in June, and my daughter, who's 6 months and looks much different from this, even though that was only 3 months ago. Fishing is something that before I moved to Florida, I never had any interest in, but I kind of acclimated to my environment. I guess the sun will do that to you. But that's a trip I took with Chris Fox, who's one of our vascular attendings. He has a beautiful boat, so we'll take it out from time to time. I'll either go with him or one of the other attendings or PAs or whatever. So it's a great time. And then for me, faith is huge, and strong believer that God has been a big part of everything that's happened so far, and hopefully carry me to everything I have dreamed. So thank you all.
Oh, this was great. And this meeting is all about establishing partnerships. So I think we already found one between you and Brian. You will catch the fish and Brian will barbecue it.
Let's do it. Actually, I love barbecuing too. So we can both throw down on the grill. I love it.
That sounds like a plan.
I love it. We'll get together at some point to do that. Actually, you're in Boston. I'll be in Providence, not too far away, and got friends in that area. So I'm sure I'll be in Boston from time to time.
I'm sure we can arrange it.
And there is where the CAR-T therapy for spine tumors will start. So I can just see all this happening.
Perfect. That's a great idea.
Yeah, I think the Amtrak's going to smell pretty fishy as you go back and forth.
It'll be worth it.
Well, exactly.
Might be the first person to grill in an Amtrak.
We're innovators, man.
We'll publish.
Yeah, I like it. All right. Well, I have the great pleasure of introducing our next speaker, Sam Hader, or actually introducing the mentor who will introduce the speaker. So Sam Hader is our next speaker, introduced by my friend Ian Lee, who serves on the Membership and Membership Services Committee on the Executive Committee.
All right. Thanks, Ryan. Yeah, so it's my pleasure to introduce Sam Hader. He is finishing up his residency at Henry Ford this year and will be going to the University of Miami next year as a neurosurgical oncology fellow. Sounds like with Dr. Ampiet as well. So I'm sure they're going to have a good time. They're being very busy. Sam has been a star from the very beginning. He is very smooth in the OR as well as on the floor. He is very smart. And he actually has many outside interests, including having pursued an MBA prior to residency. So go ahead, Sam, I'll let you take it away.
Thank you very much, Dr. Lee. Very excited to see this group, and thank you so much for the invitation, Dr. Germano, Dr. Nahed, and Dr. Panulo, and also very excited to see the work that my colleagues are doing. I'm totally humbled and very excited to see that we have a very bright future with all of us ahead of us. Now, I think I bring a little bit of a different perspective to neuro-oncologic care, and it probably has to do with my background in an MBA in health systems. I also recently completed a socioeconomic fellowship through the CNS, and all of that has kind of compounded and thematically been involved in my interest in how tumor care is actually delivered to patients. I think we're at a very surprising inflection point for innovation and technology in tumor care. And the way it'll kind of trickle down to the whole entire population, it depends on how we are able to deliver it. Compared to when I was a medical student and now, things are wildly different in almost every subspecialty in neurosurgery. I saw very little minimally invasive approaches in spine when I was a med student, but by senior residency, more than half of our simple 1 and 2 level procedures are done in a minimally invasive approach. And similarly in vascular surgery, where a lot of things were previously done with big open approaches, we're seeing that a rapid, steep curve of innovation in the endovascular world has really tipped the pendulum for how many things are done in a minimal access kind of way. And I think in a similar way, we are at that inflection point with neurosurgical oncology. Dr. Lee and Dr. Kalakanis and Dr. Robin, Dr. Rock, they've started using technology from the very get-go. So laser interstitial thermal therapy, I've noticed, was one thing we had at Henry Ford as early as 2014, making us one of the highest volume centers for it. And through all of our experience, it's only reinforced my idea that it's really going to be the future of the certain approaches we take and how we expand our treatment paradigm. In 2014, the CNS guidelines for progressive glioblastoma recommended cytoreductive surgery for symptomatic patients. And now most recently in the CNS update released by Dr. Germano, we see that it's now even considered to improve overall survival. This was very timely with one of the recent LIT studies we did, which showed that first-line treatment for recurrent GBM had very similar overall and progression-free survival compared to a matched surgical cohort. Now, my interest in neurosurgical oncology, isn't only about how we do the surgery. And during my research year, I kind of took it upon myself to actually be in a neuro-oncology clinic to get a better understanding for how is it that the care that we deliver actually impacts patients. And I've come to realize that the surgery we do is a part of the stepping stone of treatment, and the rest of their care is really predicated by all the other teams involved. And I really do credit my experience with the neuro-oncology department and our wonderful neurologist, Dr. Walbert, Dr. Schneider, to allow me to be in their clinic, where I really got to appreciate the impact of quality of life and how much that means for decision-making when it comes to treating various types of tumors, especially the higher grade ones. As a result, this kind of, once again, brings me back into full circle into why I think minimal access techniques such as LIT, as well as port and channel-based techniques to do minimal access subcortical surgery are going to be important. So some of my research has been regarding the quality of life impact as well as the economic impacts of survivorship. And I think all of that is important for tying into how we're going to get this patient, how are we going to get Medicare and Medicaid to reimburse the kinds of things we want to do, even they're at the fringe of technology and not quite widespread. Next slide, please. So as Dr. Lee mentioned, I'll be one of the rising fellows at the University of Miami with Dr. Skomatar, Dr. Ivan, and Dr. Shah. And both at Henry Ford and at U of M, these places are particularly selected because I saw that they had outstanding brain tumor programs. And from my MBA background, I was really attuned to what is it that makes a successful brain tumor program. That is something that I wanted to figure out. Dr. Kalkanis, Dr. Rosenblum, Dr. Rock really spearheaded the cancer center that we had over here at Henry Ford. And I got a taste for what it takes to develop that kind of program successfully and implement it. And now as I move on to Miami, I'll get another flavor for how Dr. Komatar and Dr. Ivan have really put the UMiami brain tumor program on the map and really increased the volume through the Sylvester Cancer Center. So once again, I kind of hope to improve and expand my experience with minimal access surgical techniques with using tubular retractor systems, as well as expanded surgical endonasal approaches and endoscopic approaches. At the beginning of my residency, I remember doing all the TSHs microscopically, coming in there with the big speculum. And now the things we do with the endoscope is just in a whole nother world. And it really makes me think very positively about our future and just very excited. As far as my personal tidbits about things that I enjoy, I'm definitely a big car guy. I went to racing school, and probably very apropos that I ended up in the Motor City here in Detroit, because there's plenty of opportunities to go racing at the track or at autocross. And I have several project cars that I'm always tinkering with. I've also been blessed with having a wife that supports this hobby and is also in the automotive industry. So we go off-roading too. once again, thank you guys very much for the invitation, and very humbled to be here. Thank you.
Thank you for sharing, Sam. This is great.
Thanks,
I guess,
Sam.
go ahead.
Sorry.
Go
No,
ahead.
go ahead, Dr. Germano.
I was going to say, I guess that the next person is Maria Noor Huda. I have the pleasure I nominated Maria, and now I have the pleasure to introduce her. Maria is part of our communication team within the executive committee of the section on tumor. She is a practicing neurosurgeon in Pakistan at the Punjab Institute of Neurosciences. She is multi-talented, as you will hear from her presentation. And also I have to disclose that all the pamphlets that have been circulated about Future Leader and will be circulated, and the previous one about headlines have been created and designed and executed by Maria. So thank you for all you've done for us. Take it from here.
Thank you very, very much, ma'am. The honor and pleasure is all mine. It has been a dream come true for me to have this privilege of working under your kind supervision and to learn from you and to have your guidance. So it means a lot to me, and being with you at the AANS Joint Section Committee was like, it has been like a matter of huge pleasure and honor for me. To thank you very, very much. I really owe it all to you. So my passion for neurological and neurosurgical oncology starts from here, that actually I've been affiliated with PINS, like Madam has mentioned, with Punjab Institute of Neurosciences, and it's just being considered as the largest dedicated neuroscience institute in Punjab in the public sector. And most of the time we receive patients from all over Pakistan. It's very huge, and everyone have a lot of trust in our institution. So, but it's a surprise that we do not have any subspecialty training, especially in neurosurgical oncology. And like I've completed my 5 years of postgraduate training from PINS, and after that it was a blind at PINS that there was nothing more for me to do, because I was just a practicing general neurosurgeon without any subspecialty training or fellowship in Pakistan. And the other thing is what I saw and what I used to feel, and I do still feel, is that glioblastoma, as we all know, is a heartbreaking, earth-shattering diagnosis. And sometimes when we diagnose a patient, it's a little, obviously we are doctors and we are humans and we do have emotion. And it's like when we are going to tell their families, it's something like, obviously, all we can do, maximum what we can do, we can just tell them what we all know, that the prognosis is quite bleak and they will be losing maximum time with that we can tell them is 18 months. And it's very, very heartbreaking. So one day, actually, when I was doing my residency, my postgraduate training, I actually developed an interest in vascular neurosurgery, and I also have an additional degree in interventional neuroradiology for that way, because I had an uncle who had an aneurysm, and he's doing great, and we were very inspired. For the first time we had this very amazing experience with the neurosurgeon. My mother is a doctor as well, but she's a biochemistry. She's quite relevant with my basic neurosciences research work that I have done. But it was the first time when we were quite inspired. But after that, when I was doing my training, I came to realize that my basic interest is in neurosurgical oncology. And since I'm interested in research and a lot of paper writing and etc., and towards more academic, so I realized that it might be my calling to join neurosurgical oncology one day, when I find the right conditions, and to introduce neurosurgical oncology in my country in order to provide better care and in order to educate and train more of my junior residents and trainees. So I want to improve my aspirations is I want to improve my level of training for neuro-oncology. I've always been looking for opportunities to get better training in the field. We've been learning virtually for quite some time now, and I hope to be able to have this chance of physical and on-site training one day once the conditions allow me to. Because during this pandemic, I was able to complete my own residency, and after that, we were like waiting, and we were quite strained in our country because it's obviously still even higher. It's hard to travel right now, not possible. So I wish to gain more knowledge and improve my qualifications, I wish and I hope to find a better opportunity soon so that I can travel and do some fellowship and more training in neurosurgical oncology. And I wish to apply it to return back in Pakistan and apply it in my own country. Now, I feel the need of building a team for research purpose and to promote education. And to fulfill this goal, I'm working through various platforms and organizing courses and webinar series in neurosurgical oncology. Otherwise, I have my own platform under the WFNS, which is known as the World Congress for Neurosurgical Residents and Medical Students. It is under the WFNS Education and Training Committee, and we are running courses. I also have an independent platform called as the News Network, the Neurosurgery Enthusiastic Women Society. And through that, I organize free courses. I do have an open edX free online school as well for self-paced courses. And I also have a free journal. I'm working on it, but it is there. And there's a visual novel under pipeline which I'm developing for the junior trainees, so they can just learn the journal management and search and management algorithms through playing a visual novel, which is a game where you have to make a choice. If it is the right choice, you will go ahead. If it is the wrong choice, you will get the guidelines. So it is something to train the junior neurosurgeons. So the research that I'm interested in is in circadian clock, the insight into circadian clock into gliomagenesis, and we all know about this chronotherapy and external cues, etc., which are quite important. So I'm working currently on that project. My personal database, I've got the honor of being selected for masters by the esteemed Harvard Medical School, Harvard University. But during the pandemic, I had this issue with my scholarship, so I had to defer my course and I had to leave. But I'm still working with the Harvard Alumni Association, and it's an honor that I'm an event manager there. So I feel so happy about it. So besides neurosurgery, I hold a diploma in artificial intelligence. As everybody leads to neurosurgery, my additional diploma is somehow helpful for neurosurgery as well. So that's one of my research work is on artificial intelligence and its application in neurosurgery, which I had the pleasure of presenting a couple of months ago in Singapore under with the ISPM. I'm also a member of the education committee of the ISPM, the International Society of Pediatric Neurosurgery. So I love traveling, and we always travel together as a family. So whenever we are traveling, I still remember my first visit to Turkey to attend IBNC in 2018 in Antalya, and I had the honor of meeting Professor Isabella Germano there for the first time, and oh my God, I was so inspired to see her, and it was like a role model to see a woman like her in leadership and with a lot of attention towards her children as well. And I was so inspired to read, Madam, your wonderful book, which has been translated to different languages as well, for kids, to inspire kids and especially girls. So it was I was so happy, I was so inspired, and I had the privilege of introducing my mother to you as well during that course. And we always travel like a family. So neurosurgery, my own training, is not only my own affair, but it was a family affair because my family was so involved and has been still involved. So they travel along and they manage a lot. And I think it's a lot of family support, especially for women involved in neurological surgery. So I think it's something very funny, but because many people consider it, oh my God, you have got a whole family. I say they are on vacation and I'm on an academic journey. So again, thank you very, very much. I think it's all about me. And again, Madam, thank you very, very much for giving me the honor of nominating me for this amazing program. And I was so happy to share something about me.
Well, thanks so much, Maria. With that, let's turn to Frank Berry. I'm trying to see if Garney is on. I just texted him, but I don't think he is.
Yeah,
He was on briefly. I think he had a conflict, so apologies.
That's okay. I will endlessly mock him while you're talking, so that will hopefully work. Then I have the pleasure of introducing Dr. Berry, who's the minimally invasive and endoscopic skull base and neurosurgical oncology fellow at the Pacific Neuroscience Institute with Garney and Dan Kelly. And with that, I'll turn it over to Frank.
Thank you so much. I'd like to thank everybody again for having me. And it's a real honor to be presenting in front of you. Thanks to Dr. Barkadarian for nominating me. My name is Frank Berry. I did my residency at Tulane University Ochsner Clinic in New Orleans and did an enfolded neurosurgical oncology fellowship during my final year and then was fortunate enough to get out to come and work with Dr. Kelly and Dr. Barkadarian at PNI in Santa Monica. And really my passion for neurosurgical oncology and skull-based surgery in particular is that I think that it's very important now that we use the modern technology and the significant advances in technology in terms of things we can use in the OR in order to help to advance the field of neurosurgery and applying these novel techniques to sort of classic neurosurgical oncology problems. And I have a real passion for working with patients who are going through difficult times. I like I'm a people person. I really like to spend time with patients, get to know them. I was fortunate enough to train in New Orleans, and we see a wide variety of patients of lower socioeconomic status who tend to have pretty advanced disease when they present it to us, as well as not very robust support systems and not very robust medical knowledge. And it's always nice to be able to connect with patients, guide them through the process through very difficult times in their lives. And then, of course, I was able to come out and do fellowship with Dr. Kelly and Dr. Barkadarian, who have been some of the pioneers in some of the minimally invasive techniques, especially using the endoscope and more minimally invasive procedures, as well as tubular retractors, and doing all types of neurosurgical oncology and skull-based surgery. Next slide. I really am excited to be a neurosurgeon and to be in the tumor field. My real aspirations, again, I'm a people person. I like working with medical students, undergraduate students, and residents. I'm hoping to be a lifelong educator and help to train the next generation of neurosurgeons. I think that as technology advances and more of these minimally invasive techniques are applied, it's very important to help spread them as far as wide as we can. I know that neurosurgery in particular has always been a little slightly staid in terms of sticking with things that we know and not wanting to try new things. But I think that the transition from microscopic to endoscopic skull-based surgery is happening, and that people are picking up on it. So I hope to be able to spread that throughout the field of neurosurgery. And I also hope to continue to push the limits of what's possible. I think it's important to have a strong team and colleagues who share the same passion. Working with our multidisciplinary team, including Dr. Griffiths with ENT and Dr. Kesari and Dr. Sharma with neurosurgical oncology at PNI, as well as our social workers, Dr. Volker with ENT. We have a whole multidisciplinary team, including endocrinology and all the other fields that participate in care of brain tumor patients. Has really opened my eyes to the importance of a multidisciplinary approach to patients with significant tumors and significant disease. So my personal tidbits, I'm very passionate and perhaps a bit obsessive about fitness. As you can see, I did an Ironman a couple years ago on the right. I was a rower for a long time and coached rowing at the junior national team level for a little while. I love the outdoors and nature. I also share the goal of hopefully one day visiting all the national parks. This is me in Rocky Mountain last summer, and I'm going up to Alaska to visit a couple this summer. And then I'm also a really big space nerd. I went to space camp twice when I was young, and have given some talks on neurosurgery in space. And I think my time to be an astronaut might have passed, but maybe one day we'll get up there. So thanks again to everybody for having me. I really appreciate the opportunity, and it's very nice to hear from you all as well.
Thank you, Frank. This was great.
Thanks, Frank. That was awesome. And on behalf of most of the nerds on here, live vicariously through you. With that, I'll turn it over to Dr. Morales, introduced by Dr. Moliterno, who serves on the CAS committee of the executive committee.
Thanks, Brian. So it's really my pleasure to introduce Saul Morales. He is currently a fellow with me in our CAST accredited neurosurgical oncology fellowship. He was born and raised in Colombia and earned his Doctor of Medicine degree at the Industrial University of Santander. He then joined the Department of Neurosurgery at the Mayo Clinic in Rochester. He worked as a research fellow there. He went on to complete his residency in neurosurgery at the University of Virginia, where he completed an unfolded fellowship in neurocritical care, During residency, he traveled to New Zealand and worked as a senior registrar at Auckland City Hospital for 1 year. And like I said, he's been spending the last year with me. He'll be done in a couple of months, and he's simply phenomenal and exceptional in every way. It's really been such a pleasure to work with him.
Thank you, Dr. Moliterno, for that kind introduction, and thank you, Drs. Germano, Panulo, and Nahed for the invitation. As Dr. Moliterno mentioned, I've been involved in different subspecialties of neurosurgery for cerebrovascular neurocritical care, but I really found my passion for brain tumor surgery and neurosurgical oncology throughout my training. My year in New Zealand allowed me to interact with a lot of brain tumor patients, as others have mentioned before, some patients that have low socioeconomic status. And in New Zealand, I saw it with the Maori population present late with big tumors, complex tumors. Especially, it's been described that the Maori population has increased incidence of meningiomas. So I interacted and treated a lot of those patients there, and I discovered that I really enjoyed working with that patient population that are facing life-changing diagnosis many times. So that's when I fell in love with neurosurgical oncology, and I enjoy a lot of things about it. So one of them is the challenging nature, again of complex cases that require in-depth knowledge of neuroanatomy and also meticulous and microsurgical skills. The case variety, no two tumors are the same. So here I'm showing a few of the cases that I've done during fellowship with Dr. Moliterno. Up top, the two pictures are the same patient, 47-year-old female that presented with seizures and was found to have this temporal insular glioma. The picture on the right is intraoperative after we removed that temporal component of the tumor, and we're showing there the tentorial edge, the third nerve, and the PCA. So tumors like this, insular gliomas or other gliomas in eloquent areas are common for our practice, and I really enjoy doing those cases. Some others at the bottom here, vestibular schwannomas, like this one on the bottom left, young 20-year-old patient that presented with headaches and imbalance, and then went to the eye doctor, was found to have papilledema. Tumors in and around the foreventricle, like the middle one at the bottom, and anterior and middle fossa meningiomas, like the one at the bottom right. This tumor was encasing the ICA bifurcation, but we were able to remove it safely. So all of these tumors are very challenging, can be nerve-wracking initially when you're first approaching them, but they can also be very rewarding when you can treat that and the patients do well after surgery. I also enjoy the multidisciplinary collaboration that comes with neurosurgical oncology in the OR with neurotology, head and neck surgery, neuro-ophthalmology, and outside the OR with neuro-oncology, radiation oncology, and others as well. You can go to the next slide. So my aspirations as a brain tumor surgeon are to consolidate a strong neurosurgical oncology practice, building relationship with other neurosurgeons, with referring physicians. We've all seen across the country how important this is, and we know it takes time and perseverance, but I want to get to that point of building a strong program. To contribute to medical student and resident education in neurosurgical oncology, currently doing it once a week with the residents here at Yale, and I want to continue to be involved in that with resident education, webinars, microsurgical anatomy labs. And last but not least, obviously we all share that passion for the research side as well. So collaborating translational research and clinical trials. Here I've been involved with the neuro-oncology team in a phase 1 trial of anti-TIGIT antibody and anti-PD-1 antibody to treat recurrent GBM. And also being here with the pioneers in understanding the genomic landscape of meningiomas. I want to apply that to my practice and to manage patients according to their meningioma subtypes and different outcomes that we are learning more about. Outside of neurosurgery, I enjoy being outside, running, hiking. These pictures on the left are of me hiking around New Zealand when I was there for a year. And then skiing as well. During the winter, I try to get out there to the west and enjoy my time on the slopes. So thank you again for this opportunity.
Thank you for sharing all this with us. And I see that Dr. Chetan Bedagowda was able to join us from the OR. Chetan, do you want to chime in?
Absolutely. First, apologies for running late from the operating room, but it's my pleasure to say a few words about Jordina, who truly represents the very best of neurosurgery. She's a triple threat, and as you heard, has done outstanding work. And we're very excited to see her join the neurosurgery faculty at Johns Hopkins on July 1st. But in brief, her academic work has just been extraordinary. She's the first neurosurgery resident I know of who's completed clinical training as well as a PhD simultaneously in 7 years. And it's a reflection of her dedication to both patient care as well as research. And she's focused on the lab and developing novel therapeutics that we hope will have positive impact in the forthcoming clinical trials for glioblastoma patients. And it's a real honor and privilege to be able to work with Jordina, who's a real force of nature and certainly be a star in the AANS tumor section. So thank you for the opportunity, Isabel.
Well, thank you all. This is really, this is the first time that we did this format. It's our pilot of taking what we had done with having faculty come on and talk about themselves and introduce each other. And we wanted to expand this to pull in what is clearly rising stars in neurosurgery. This is our future. This is why we show up at work every day and hope that someday we'll see people like you guys come up the ranks and be truly future leaders. So we're really grateful, number one, that you guys showed up. Number two, that your mentors, pitched you, because they all did a really good job of doing that. And I was really happy to see the poster. I was really actually moved when I saw Maria's poster, and I just saw the constellation of humanity here that's become our neurosurgeons. The face of neurosurgery is really very different from what it had been when Dr. Germano and I and Dr. Ney had started out. So and your mentors as well. So I'm really grateful that this is working. Thank you, Dr. Germano, for making this happen. And Brian, I'll let you close.
Yeah, I mean, just to echo what Susan said, it's just so wonderful to see our community growing and also to see the rising stars. And this has just been really fun. And, I have the luckiest job of everyone here working with both Isabel and Susan. So thank you again to everyone. I look forward to the next one. This has been really, really cool and really fun.
So I have just one request, and that is that one day we will all meet and have that beautiful fish barbecued and raise a glass together. So maybe we can start doing that at the AANS.
Sounds great. Sounds like a plan.
Thank you.
Bye, guys.
Have a good evening.